Good afternoon, Mr. Gonzalez. How are you today?
I'm quite well, thank you.
Good. My name is Kira Anderson. I'm an occupational therapy student at Texas Women's University. Today I'm going to be assessing some of your range of motion with a tool called a goniometer. It looks like this, okay? We want to make sure you have sufficient range of motion for the occupations that you must follow through with in your daily life, okay? So the first thing I'm going to do is ask you to move, copy my movements, and then I'm actually going to measure them, okay? We're going to be testing your right shoulder extension, your right elbow flexion, and then we're going to be looking at your left wrist ulnar deviation, okay? So the first thing I want you to do with your right shoulder is move it just the way I'm moving it, okay? You try. Very good, okay? Now I'm going to assess the range of motion on your shoulder extension, otherwise known as hyperextension, okay? I'm putting my axis on your humeral head, okay? And now please go ahead and do the movement for me. I'm keeping my stationary bar parallel to your trunk. Very good. Okay, Mr. Gonzalez, your movement on right shoulder hyperextension is 0 to 50 degrees, which puts you within the functional limit. Functionally, we look at 45 degrees for that range of motion, okay? The next thing that we are going to assess is your right elbow flexion. I want you to copy the movement, hold your arm straight down at your side, and bend up in bicep curl formation. Good. And now straighten it back down. Okay, that's the movement I'm going to measure next. So I'm going to put the goniometer on you. Okay, my axis is going to go on your lateral epicondyle of the humerus. And you can go ahead and bend up for me. Very good, okay, and bring it back down. Okay, Mr. Gonzalez, for right elbow flexion, you have 0 to 140 degrees. We normally look for 145 degrees, so 140 degrees is functional. Sometimes people have less range of motion due to muscle bulk in their arm. They can't flex it as much because the muscle starts getting in the way. Very nice. Okay, Mr. Gonzalez, we're going to switch places now so that I can work on your left wrist ulnar deviation. Thank you. Okay, so Mr. Gonzalez, first I want you to copy this motion. Move your wrist towards the pinky side. Very good. Move it back. Okay. Now I'm going to place my axis at the base of your third metacarpal. Okay. Now I want you to move in that direction that we just moved in. Very good. Okay, Mr. Gonzalez, for ulnar deviation, I have you at 0 to 40 degrees. I'm going to mark that down. Our normal range of motion, we look to get about 30 degrees, so you have plenty of range of motion on this joint. Mr. Gonzalez, that's all we're going to do today. Do you have any questions for me?
No.
Thank you so much.